Welcome. I'm Jim Pursley, president here at Hinge Health. And today we have an exciting new episode of Pain Points, an ongoing series where I'm joined by leaders, experts, and practitioners from industry and academia to explore topics at the intersection of healthcare, technology, and innovation. On this year's final episode, I'm joined by Kelsay, president and CEO of the Business Group on Health. Ellen, thank you for joining me today. I've been looking forward to this all year. Given your reputation, it may be unnecessary, but can you share a little of your background for any of our audience who maybe isn't already familiar with you?
Sure, and thanks so much for having me with you, Jim. I've been looking forward to this for a while, and delighted to get to round out your year here. My name is Kelsay. I am President and CEO at Business Group on Health. I have been here for 7 years, the past 4 as President and CEO. Most of my career, though, prior to joining the business group, I was 20 years at Mercer in a number of different roles. I grew up at Mercer, was pretty entry level, worked my way up through the ranks, and my last role at Mercer for a number of years was leading one of their largest regions globally in their health and benefits practice, which has served me well in my role here at the business group. And at the business group, we represent the interest of large employers on an array of really challenging and critically important health and well-being issues.
Yeah, it's hard to believe that's been 7 years. Time moves awfully fast, doesn't it?
Sure does.
Well, I'm excited today to talk to you about the Business Group on Health and your annual large employer healthcare strategy survey, which just recently came out. And for anybody who isn't familiar with it, it's a great resource to help understand the evolving views of large employers. So I thought maybe we could dive into a few of the key findings from the report. And then I also want to pick your brain on some general predictions you have. This is that time of year where we prognosticate and look to the future, and would love to get some of your predictions as we look into 2024. So quickly, some housekeeping. If you're tuning in on LinkedIn, we'll share a comment with a link to where you can find more information on the BGH report. And if you have any questions throughout this conversation with Ellen, please feel free to put them in the comment section, and we'll do our very best to fit them in and get them answered here during Pain Points. So with that, why don't we start with a trend that stuck out to me, a particular trend that stuck out to me, which was employers are more carefully evaluating partnerships and vendors, a word I struggle with sometimes, to ensure that they result in higher quality, more cost-effective care. What are you guys seeing on that front?
Yeah, that one caught the attention of a lot of folks. Some consternation for folks as they look at that, wondering if it applies to them. Are they a vendor? Are they a partner? and might employers be reevaluating their role in their ecosystem of partnerships? It was really the first time we asked that question in our survey, and we had 38% of our respondents indicating that, yes, they do intend to take a sharper look at their partnerships and may even explore transitions away from certain partners in the year ahead, driven for a number of different reasons. No one singular thing that we can point to, but among the factors were concerns about persistent cost, quality, and patient experience issues that have not gotten better, and in some instances have gotten worse over the years. So employers wanting to take a more discerning look at their partnerships. Are those partners driving the value and outcomes that they professed they would when they were implemented any number of years ago? Certainly, the economy has created a heightened focus on that as well. Employers needing to take a hard look at who they're partnered with. Are those, again, partners driving the outcomes and improvements necessary in outcomes, quality, cost, and experience? And then also, I think, a heightened concern about fragmentation within their own ecosystem of partners. Many employers during the pandemic did a lot of good work in terms of adding new partnerships into the equation, really out of necessity, in a number of different clinical areas, as well as virtual health areas, to address challenges within their workforce, within the population, and hoping to address some challenges around access to services during the height of the pandemic. Now that we're in a post-pandemic environment, employers are looking back at all those partnerships to say, do we need them all? Are some of them redundant and duplicative? Are there ways that those partners should be working differently with one another and across the continuum of the services? So for all of those reasons, employers are taking a step back, looking at how they partner, with whom they partner, and then holding those they remain partnered with to higher standards and levels of accountability in terms of performance.
Yeah, which I think is really a healthy thing for the industry at large. There's a phrase that we often hear, point solution fatigue, or vendor fatigue. And looking at both your report and just experientially, I'm not sure if it's as much fatigue as it is. I think the word you used was discernment, and really becoming more discerning, and looking. I think employers are still going to adopt best in class solutions because there's too many big challenges that they need to get their arms around. But I think your point is spot on, that they desire more accountability, more transparency, and more connectedness, starting to connect those dots. And I think those companies that are able to provide accountability and transparency and play nice in the sandbox are going to be well positioned to continue to succeed. And those that aren't, may find themselves on the outside looking in. So I think the bar, to your point, I think the bar is raising. But ultimately, that's a good thing. I think that shows a maturation in the industry. And I think all of us need to be challenged to keep raising that bar. So good insight there. It's also clear from the survey that mental health, which is a topic that we talked a lot about during the pandemic, but mental health challenges are not receding, and they seem to remain on the rise. Can you maybe share some results in the area of mental health?
Yeah, it's really troubling. And again, probably not surprised to anybody who has been paying attention to what's been going on in recent years. We continue to see mental health challenges across the entirety of society increase, not only the workforce and their dependence on employer plans, but all of us in real life have experienced these challenges related to mental health and emotional well-being. So employers too have been taking a very sharp look at that within how do they support their workforce, what can they do in terms of programs and other resources to better support them and their family members as they're dealing with all of life's challenges. What we saw in our survey is that 77% of employer respondents noted a sharp increase in the need and demand for mental health services. That was a considerable jump from the year prior, where it was just reported by 44% of respondents. So big jump year over year in that. And lots of things that employers have been doing and will continue to do to support their workforce. We've seen, as I mentioned earlier, a number of employers offer some increased solutions in the virtual health and virtual telemental health space during the pandemic. They continue to do that because we all know that there's a shortage of providers. You often cannot get an appointment in person to see a mental health or behavioral health counselor when you need to. So telehealth and virtual health solutions have really been a wonderful augmentation to brick and mortar types of providers in that space. Many employers have also done a lot of work around anti-stigma campaigns to encourage people to speak openly, to seek help when necessary. Those employers that have on-site clinics have also added behavioral health and mental health counseling to the suite of services on-site. So lots of things employers have done, will continue to do. Some areas of additional focus will be really expecting their partners, whether it be a health plan partner, an EAP partner, or even all these virtual health solution providers in the mental health space, to continue to expand their networks, to look for more diversity in providers within their networks. And there are a couple areas that we noted. We just released our Trends to Watch for 2024 last week. And within that, there are a couple areas of emerging concern, not new concern, but I think heightened focus for employers within mental health. And those would be specifically related to youth, adolescent, and young adult mental health, as well as suicide prevention. So additional areas that employers, are going to be taking a closer look at. And really across all of these, many employers have a number of solutions and partners that they work with within behavioral health and mental health, and they're looking for stronger integration and more holistic care across the continuum of needs that their workforce might have in all these areas.
Yeah, it's there's a lot of good companies doing really good work in this space. But it's a good reminder, I think, for all of us, especially here at the holidays. It can be a hard time, a lonely time for a lot of people, and it's just a good reminder for all of us to check in on those we love and care about. And the challenge of depression, anxiety, substance use disorder, certainly not going away. And this time year can be particularly challenging. Interestingly, we also here at Hinge see a really strong link between physical pain and mental health. We did a survey earlier in the year of 1,500 Americans and found that 74% of people in pain indicated they had struggles with mental health as well, specifically with depression, anxiety. and that can lead to feelings of isolation. And so, in addition to addressing the physical pain, the chronic pain, just checking in on people and trying to help combat those feelings of isolation is really something that, again, not only those of us at Hinge, but across the healthcare landscape can be more, I think, aware of. As we think about, I think you used the term access at one point. That was another trend that seems to be front and center, is this idea of providing accessible, affordable healthcare, oftentimes with a focus on underserved communities or specific populations within the workforce. Tell me a little bit about what you guys are seeing in terms of addressing that accessibility and affordability gap.
Oh, they're huge areas of focus. Certainly for certain marginalized communities, they are disproportionately impacted and more readily challenged with accessing care, or might be working in jobs where it's hard to take time off from work to seek care. So the accessibility and affordability is much more acute for certain populations within the workforce. In our survey, that you mentioned earlier, Jim, we do ask a number of questions related to health equity within benefit and well-being programs, and specific areas that employers are focused on, and tactics that they're deploying to really remove and address any barriers that may exist. So there are a number of things that employers have done, are continuing to do, and probably will need to, unfortunately, be resolved and staying focused on for the years ahead, as none of these are easy challenges to overcome, but they are certainly chipping away at it every little bit that they can. And there is a large swath of very different needs within a workforce. So you could be an employer that has a large population that works and resides in a rural area, and they're going to have very uniquely different access challenges. You could be an employer that has a younger population that prefers virtual versus in-person care, and making sure that the virtual technology is accessible and used by all. You could certainly have a considerable portion of your population that might be LGBTQ plus or BIPOC. And so making sure that the solutions, the partnerships that are in place are not potentially exacerbating inequities, but are doing everything possible to address those inequities. And certainly the affordability point, Jim, that you mentioned earlier, healthcare costs are getting worse, they're not getting better. We saw in our survey this year, trend numbers reaching a high level than they have historically. We're in a macroeconomic environment that has been more challenged recently. And so for a number of reasons, affordability across the entirety of the workforce, but again, making sure that for those that are perhaps marginalized or more challenged in certain areas aren't disproportionately negatively impacted.
Yeah. It's certainly affordability, access, and availability are, if we don't solve those things, it really lays waste to some of our best made plans. Our focus has largely been in the MSK space, but I think the experience that we've gained can be applied across the healthcare landscape. Some just things to think about for our audience as we think about kind of closing that gap from employers. One is deploying digital technology. We talked about that. You have to have a high bar. You have to be discerning. But I do think digital tools, I don't think there's any question those digital tools could help address those access and affordability gaps. Removing barriers too. We still make it really hard, I think, for people to get care. Oftentimes well-intentioned, but whether it's prior authorization hurdles, out-of-pocket costs with co-pays, and so how do we find ways to reduce friction and remove those barriers to care? And this one's specifically to our digital health. If there's a digital health audience here, is thinking about hybrid care. One size doesn't fit all, and really meeting members where they are, whether it's access to technology necessary or just the desire to, I think, interface with people in person. We found by delivering hybrid care, being able to offer in-person physical therapy in addition to digital physical therapy, it helps to create a more comprehensive safety net for people who don't always want to engage in one specific way. So just a couple of ideas there for folks, whether you're on the digital health side of the audience or maybe you're a large employer trying to think about how to tackle that affordability and access gap there. Maybe we can take that as an opportunity to transition from trends to some predictions. So I want to spend a few minutes maybe picking your brain, Ellen, on the predictions you have for the year ahead. And I feel like we couldn't have a predictions conversation without discussing artificial intelligence. AI seems to be on the front of all the newspapers, whether it's the technology itself or all the colorful characters and boards and companies trying to do good work in AI. It is certainly a hot topic. So as you think about employers and healthcare, what do you think the impact of AI is going to be here in 2024?
It's interesting. We've had a number of different forums here at the business group where we've talked about it, and the range of responses from AI are anywhere from overrated to underhyped and probably everywhere in between. But no doubt AI is here. It's already having tremendous impact on health and benefits and well-being offerings. There's a lot we don't know. We don't know how it will continue to evolve, but some real good use cases that already exist across a number of different dimensions. There's certainly operational and administrative benefits that come from deploying AI within healthcare, whether that be claims and billing or ease of appointment scheduling. Certainly there is patient experience and a more personalized approach to a patient's care pathway, better support around navigation of that patient throughout their clinical journey, and then obviously clinical efficiencies. Definitely want to note that AI is, most people would say it's not ever going to replace the human, but it can certainly augment the human care teams and provide leverage to those clinical teams that are working with patients, and whether that be, improved diagnostic accuracy, reading of scans, a lot of those things that happen, on a fairly frequent basis that could be automated and free up the humans to do more of the necessary care that they need to do with their patients. So, anybody's guess exactly how quickly we'll see the full benefits of AI, but no doubt it's already here and continuing to evolve lightning fast. None of us can keep up with the speed of it, but it's exciting to see. I will say, all that said, though, when you ask employers, when you ask patients, there are some concerns, related to privacy, accuracy of information, to the point we referenced earlier on some marginalized groups. It's well founded that some of the data sets that AI is pulling from does not represent a diverse patient population. So might it perhaps perpetuate inequities in care delivery? So really wanting to make sure that, we are taking a hard and discerning look at some of those potential challenges related to AI, but certainly there's unbelievable potential as well.
Yeah, absolutely. I think there are going to be those that look at AI as an opportunity to replace high-cost human labor. My experience with my airline, which will go unnamed, and the AI chatbots, I would not encourage to replace people. I think the way we're thinking about it at Hinge is exactly what you said, which is augmenting. It's amazing how much more powerful, how much more efficient you can make a human clinician by giving them insights, allow them to digest massive amounts of information and synthesize it at their fingertips, to be able to help to draft communication. There's a lot of ways that we can make our people more powerful. I think that's what we're most excited about the role of AI to empower our people, not to replace them. But we'll see. It's evolving rapidly, and I'm sure there will come a day when I may not mind talking to the chatbot at the airline as much as I do today. So I'm the one you can just, if you catch me in my office yelling representative over and over again, that's been my...
We've all been there.
That's been one of my AI experiences. So switching gears from AI, consolidation in healthcare is another frequently discussed topic, especially when you see this last year in 23, the capital markets, you see some headwinds, inflation, increasing costs. It tends to lead in some industries to consolidation. Do you think we'll see more or less? Do you think we'll see consolidation at all in healthcare in 2024?
I love this question. Yes, we will definitely see some consolidation, although I think it depends on the nature of the consolidation and whether it's necessarily good or perhaps not favorable. I say that because, we've seen a lot of consolidation within the industry over many, many years. We've seen, hospitals acquire other hospitals. We've seen hospitals acquire local community physician groups. We've seen health plans acquire PBMs, health plans acquire other PBMs. Not all of that consolidation has been favorable. In many cases, in fact, it has not resulted in improved cost, quality, outcomes, and experience. So that type of consolidation in and of itself may not be viewed as favorable as perhaps others. The other that would be viewed more favorably is within this point solution landscape, where we have come out of a period of hyper innovation, lots of new solutions coming to market, not only over the past few years, but the past decade, where you have multiple solutions within each category, seemingly hard to differentiate from one another, creating fragmentation of care. Back to the point earlier when you asked about employers kind of evaluating partnerships and the vendors is really are all of those solutions delivering the best service? Are they delivering improvements in outcomes? And employers really looking to streamline the patient experience, have a more holistic, longitudinal patient experience across a number of different areas. One example that I often refer to is the mental and behavioral health space, where there's unbelievable need and challenge and a tremendous amount of innovation and solutions that have emerged over the past 5 years in this space. But if you were to ask an employer or ask an employee of that employer, where do they go for their teen child who has got a behavioral health need versus a transgender individual who might have a behavioral health need? Is it the EAP? Is it a standalone provider? Is it the health plan? Is it a virtual? Is it in person? There are probably in many employers' ecosystems, maybe a handful of solutions that could potentially help solve that need. And so employers are taking that discerning look to say, do I need all of these? Could these integrate? Could there be some synergies here with consolidation within the behavioral health and mental health space? So I think we will continue to see consolidation within solution categories like that. And that is needed. It's needed to rationalize the market a bit more. And it's also needed from a patient care experience perspective as well.
Yeah, you feel like it's hard enough some days to point employees and dependents in the right direction for just the category of mental health, just, that digital is an option, let alone for them to have to think about who, what is the socio-demographic of that individual who needs mental health support. And then there's a different solution for, 8 different personas. That's challenging enough. And so, yeah, interesting on the consolidation front. I don't know if you saw this morning, but it looks like Cigna has abandoned their bid for Humana. So as you said, maybe not all consolidation needs to happen, and that might be an example of we'll see how things shake out in the months ahead. But that was breaking news this morning. Looks like Cigna is walking away from that deal. So interesting. Well, as we get to the end of our time together, it was first of all, thank you again. Great to have this conversation. I'd like to get you to kind of opine a little bit on, we talked about a lot of things that are going to happen. The advent of AI, consolidation, continued investment in digital health, but more discerning. What do you think might not happen next year? Is there a trend? Is there a buzzword, things that we've been talking about for years that are starting to recede from view, things that are kind of falling out of favor in the conference lexicon? I'd love to get your thoughts on, is there anything that's not going to happen in 2024?
I wish I could deselect something. I think it all still remains largely vitally important. I'll answer this kind of twofold. I think one is a concern I have that some things that need to be focused on with continued rigor may unintentionally take a backseat to other things that are emerging in terms of priorities. So the example I'll use is health equity, which we've talked a lot about. Still a long way to go in terms of solving for that. The challenges are getting worse. But we also have affordability and cost issues that require unbelievable focus right now and discipline to address macroeconomic challenges, as well as pharmaceutical impacts driving up costs. So do the focus and efforts put forth there somehow mean that there'll be less of a focus in other areas like health equity? I certainly hope not. I'm not predicting that, but I do have a caution and would really encourage folks out there who are listening to try and find a way to balance some very important priorities, equally important in their own regard. I do think one area, to kind of the flip side of answering that question, not a trend that I think is dissipating, but back to the earlier discussion really all throughout, is this need for integration and consolidation in the point solution space. We will still have point solutions. We will have new entrants that are unbelievably compelling and worthy, and employers will implement them. But will we see the bevy and the flurry of activity? Will we see employers rush to pilot anything and everything they possibly can? Likely not. So we won't see point solutions go away, but we will have a much heightened focus on really bringing forth only those solutions that are absolutely necessary, that are addressing some sorely needed areas within their population from a clinical perspective, but increasingly looking at the need for consolidation and integration across the existing solutions. So I think we'll continue to have them, but we'll see a more moderate and rationalized approach.
Yeah, well, I think just hearing you say that, what's encouraging, and I realize this sounds a little bit self-serving, but what's encouraging about that is I think for those solutions, regardless of what the specialty is, if they really are achieving that bar, back to your comment about health equity and in a cost-constrained environment, digital health, if done well and done right, can address those simultaneously. They're not at odds. You can actually improve access and affordability and equity while lowering cost. And so I think it's incumbent on all of us, being those on the technology side of the house, that's really how we have to design our solutions. And things like ROI, I think the bar is going to continue to be raised, and it should. Is the ROI developed by actuaries or by marketing people? And there's, I think there's a little bit of a credibility gap in digital health that's warranted, because a lot of the ROI is developed by marketing people. And but if we can develop the solutions developed by technologists, affirmed by actuaries, some of these seemingly opposing forces, we might be able to reconcile those in some pretty novel ways. So, I think you and I are both optimists, and we'll choose to look towards 2024 with a sense of cautious optimism.
For sure, no doubt about it. Yeah.
Yeah, fantastic. Well, Ellen, thank you again. To the audience, Ellen Kelsay, President and CEO of Business Group Mental Health. We covered a lot of ground today, again, from the rise of AI to the continued importance to invest in mental health, in improving health equity, in the bar being raised for digital health, and the convergence. For those of us maybe that can't get over that bar, seeing solutions consolidate to take cost out and to improve the impact of digital health. A lot to cover there, a lot to think about here as we wrap up the year and look towards 2024 with enthusiasm and optimism. To our audience who took the time to join us today, thank you, either live or later. And I'm your host, Jim Pursley, and I hope to see you on our next episode of Pain Points. Have a great day.